Every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, which is congestive heart failure. Good morning.
Good morning.
So first of all, what is congestive heart failure?
Well, we're talking about the heart, and the heart is a pump. So it takes less oxygenated blood from the body and throws it through the lungs where it gains oxygen and then pumps it back out to the brain, the heart itself, the lungs, the organs, and the muscles. So when that heart doesn't work and it slows down and it works less efficiently, that's called congestive heart failure.
And is congestive heart failure common?
It is, especially as we age, although in ice users we see it earlier than in others. Congestive heart failure affects millions of people, especially those that have heart disease and high blood pressure.
And what are some signs?
Signs include the ones from the lungs, which is shortness of breath, especially when we're lying flat, and fatigue all the time, inability to mobilize as much as we should. It also, when it goes down to the feet, it causes swelling of the legs, ankles, and feet. And all of those are congestive heart failure symptoms.
Okay, and what are the causes?
The causes basically are atherosclerotic heart disease or coronary artery disease, including heart attack. High blood pressure is a cause. Cardiomyopathy, where the heart doesn't beat very strongly because of either a toxin such as alcohol or drugs, or because you have problems with a virus that has affected your heart. And there are other heart causes, but there are also lung causes like smoking, emphysema, diabetes is a cause, obesity, and as I mentioned, alcohol use.
And how do you get diagnosed?
You go to the doctor because of your symptoms, and the doctor will do a history and a physical exam and will confirm his thought or her thought with getting a chest x-ray, an EKG, and frequently an echocardiogram, which is a very safe study, which is basically an ultrasound of the heart.
And if you do have congestive heart failure, what are the treatments available?
Well, there are natural treatments, Christine, including avoidance of salt, and that includes the prepared foods, bacon, Spam, ham, sausages, all the things we love.
Right.
Avoidance of shoyu, ketchup, and tomato sauces, pizza, chips. All of these things are high salt, and you have to cut down on those, more fruits and vegetables.
And alcohol reduction as well.
Alcohol reduction is very important.
Okay.
And gradual aerobic exercise, preferably under the direction of your doctor. All of these things will help in terms of natural things. And then we have the medications.
Okay.
We have the ACE inhibitors, which have been around 50 years and are called the Prills. And sometimes, unfortunately, we get a little cough or tickle in the throat. So about 25 years, we've had the ARBs, or angiotensin receptor blockers. Losartan that you're holding up is one of the ARBs. I take that for high blood pressure, but it's also good for congestive heart failure.
Okay.
And there are examples like losartan, irbesartan, candesartan, all the ones that end in sartan. And then there are the beta blockers, which have been around for more than 50 years. Those drugs include propranolol, atenolol, and metoprolol.
This
is
right here.
metoprolol that I take for my blood pressure,
Okay.
but it is also very effective for congestive heart failure. We have diuretics or water pills that cause the kidneys to waste potassium out the urine, sodium out the urine, and also potassium. And those salts, when they leave the body, draw water with them. So water pills have you create water with your urine. And then finally, digoxin, which has been around a long time and helps the heart beat a little more strongly. And those medications supplement the very important natural therapies for congestive heart failure.
Okay. And you'll be back here next week to talk about
We are going to talk about lung cancer.
lung cancer. Okay. We thank you so much for being here again. Have a good weekend.
You too.
Thank you.